Welcome to McTox Curriculum, brought to you in collaboration with Western University, the University of British Columbia, and McMaster University. This presentation is part of McTox Curriculum built for residents and fellows from PGY 1 to 5. Today's topic is on antihistamines, and it's brought to you by Bandar Ba. This module will cover the pathophysiology of histamine and its effect on different histamine receptors. It will allow learners to differentiate between the different antihistamines based on their clinical effects and to develop an approach to the treatment of an antihistamine overdose. Our case for today is a 19-year-old female who's been admitted with a diphenhydramine overdose. She took approximately 30 tablets of 50 milligrams about 4 hours ago. When you examine her, she is drowsy and actively responding to visual hallucinations, and her pupils are dilated. On the cardiac monitor, her current vital signs show hypotension and tachycardia, but she is afebrile and maintaining her oxygenation. The nurses quickly get IV access, and she receives 2 liters of normal saline, which improves her blood pressure and heart rate. She's also given 2 milligrams of IV lorazepam times 3, but she's still quite agitated and hallucinating. Her treating physician has asked for your help because he was concerned about over-sedating her with benzos. What would be your recommendations for the physician? And are there any other risks associated with an overdose on diphenhydramine? To answer that question, let's discuss the clinical effects of antihistamines in an overdose setting. Most antihistamines are easy to access, as they are over-the-counter medications at most drugstores. They are found in sleeping aids, cough and cold medications, as well as in pills for the treatment of allergies and motion sickness. Preparations for treating cold symptoms usually have more than just antihistamines in them. They can also include decongestants, which are alpha agonists, like ephedrine, pseudoephedrine, and phenylephrine. Histamine itself is a local cellular mediator, or hormone, that has many different actions. These cellular mechanisms include allergic and inflammatory responses, gastric acid secretion, and it may also act as a neurotransmitter in certain areas of the brain. There are 4 types of histamine receptors that are found in almost all tissues in the body in different distribution patterns. H1 and H2 receptors are the only clinically relevant ones that we'll focus on here. H1 receptors are spread throughout the body and are present in most tissues, while H2 receptors are found primarily in gastric parietal cells. Histamine interacts with G protein receptors, which results in the activation of a second messenger protein that causes the desired end organ effects, such as smooth muscle contraction and gastric acid secretion. Activation of the H1 receptors causes depression of the central nervous system, the severity of which will depend on the degree of stimulation. It can also lead to slowing of the AV node, vasodilation, and increased vascular permeability leading to edema. Triggering the H1 receptors in the airway can stimulate smooth muscle constriction and cause bronchospasm. What we just covered was the physiologic effects of histamine and activation of H1 receptors. Now we'll discuss the clinical effects of an antihistamine overdose. Generally, H1 blockers cause mydriasis, dry mouth, sedation, nystagmus, and even rhabdo. Second and third generation H1 blockers are more selective and have limited anticholinergic and neurologic effects. In addition to general antihistamine effects, first-generation antihistamines are characterized by their ability to cross the blood-brain barrier and cause decreased LOC. They also have some anticholinergic activity through action on muscarinic receptors. Diphenhydramine is a unique first-generation H1 antihistamine because it acts as a sodium channel blocker in an overdose scenario. This explains its ability to widen the QRS and cause prolongation of the QTC. As we mentioned before, H2 is the only other clinically important histamine receptor. Its activation leads to secretion of gastric acid from parietal cells in the stomach. We won't discuss the H3 and 4 receptors as they have no known clinical importance to date. H2 blockers are designed to target acid-producing cells in the stomach and not any other histamine receptors. Overdose on H2 blockers don't usually lead to any significant harm or toxidrome. Its clinical implications are more due to its ability to cause drug-drug interactions. Cimetidine is known for its inhibition of several cytochrome P450 isoenzymes as well as glycoprotein. This can interfere with the metabolism or excretion of other drugs, which will prolong their half-life and cause possible side effects. Now back to our original case. This patient overdosed on diphenhydramine and has been persistently agitated and hallucinating despite treatment with multiple doses of benzos. The question was, is there a safer way and more effective way to control her neuroexcitation? In some cases, overdose on antihistamine medications can lead to severe agitation like in this patient. When large doses of benzos are needed for sedation, and there is concern about loss of airway protection, physostigmine can be given to antagonize the central CNS effects of diphenhydramine. If using this option, the treating physician should ensure a carefully monitored setting, as well as rule out any contraindications beforehand. Have the patient connected to a cardiac monitor and slowly push 1 to 2 milligrams of physostigmine IV. Atropine should be at the bedside to correct any cholinergic effects from overshooting. Contraindications to giving physostigmine are a wide QRS, severe bradycardia, history of asthma, or other pulmonary diseases. The questions to finish for this module are 1. Which class of antihistamines cause CNS effects and why? 2. List 2 serious cardiac effects of a diphenhydramine overdose. And 3. In a multi-medication overdose, what is the effect of antihistamine drugs on absorption? And that's it. Thanks for watching.